Assalamu alaikum. Hello, colleagues and students. I would like to continue with you the lecture of a classification of periodontal disease. Periodontitis can be defined as an inflammatory condition affecting the gingiva and involving the supporting apparatus of the teeth, including alveolar bone, periodontal ligament, and cementum, resulting in destruction of alveolar bone and loss of attachment with apical migration of junctional epithelium. In 1999, the periodontitis was classified mainly into chronic periodontitis and aggressive periodontitis, in addition to periodontitis as a manifestation of systemic disease. Of course, you may ask me why you mention these two types of periodontitis and nowadays they omitted from the new classification system of 2017. And I will answer you since it's widely used in books and literature till now, we must have an idea about the chronic periodontitis and aggressive periodontitis. So, I will start with a chronic periodontitis, which is a term replace the previous term of adult periodontitis, since this form of periodontal disease can occur over a wide age range and could be found in both a primary and secondary dentition, although it is mostly found in adult people. The most important clinical sign associated with chronic periodontitis, first, the amount of periodontal tissue destruction should be proportional to the amount of the plaque present inside the patient's mouth. That is to say, when there is a high amount of plaque, there will be a high destruction rate, while little amount of deposit will lead to little destruction in the periodontal tissue. Also, the presence of subgingival calculus is a frequent finding, and slow to moderate rate of progression may be found in this disease, but we may have a period of rapid progression. The second type of periodontitis that was proposed in 1999 was aggressive periodontitis, which is divided into localized and generalized aggressive periodontitis. The term aggressive periodontitis replaced the previous name that found in previous classification, such as rapidly progressive periodontitis, because this term is too restrictive and feature of this form of periodontitis could occur at any age group, and the classification for various forms of periodontitis should not be based on the age of the patient or at the rate of the progression, but should be based on a clinical, radiographical, historical, and laboratory findings. And if you want to study the most common feature of localized and generalized form of aggressive periodontitis, you will find, except of the presence of periodontitis, the patient are otherwise clinically healthy. Also, rapid attachment loss and bone destruction may be found in those patients with familial aggregation, in addition to amount of microbial deposit are inconsistent with the severity of periodontal tissue destruction. That is to say, mean little amount of biofilm may cause a severe destruction in periodontal tissue. As you see in this picture, the patient has a little amount of deposit, but after clinical and oral examination of such patient, we will have a severe form of periodontal destruction. Recently, in 2017, and based on pathophysiology, three clearly different forms of periodontitis have been identified according to the new classification system proposed by American Academy of Periodontology and European Federation of Periodontology. in 2017. The three forms include first, periodontitis, second, periodontitis as a direct manifestation of systemic disease, and finally, necrotizing periodontitis. And I will start with the most important type since it affects people more than other types. It was classified according to different form of stages and grading. Stages relies on the standard dimension of severity and extent of periodontitis at a presentation, which can be measured by clinical attachment loss or radiographical bone loss. The extent and distribution for each stage described as a molar incisor pattern or localized if the involved site was less than 30% or generalized if the involved site was equal or more than 30%. That is to say, the borderline between localized and generalized periodontitis was 30%. We examine all the teeth and record the site that involve the attachment loss. Then we calculate the percentage of affected site. If it is less than 30%, we can say it is localized, while in case of equal or more than 30%, mean that the condition is generalized. And you may ask me, what does staging mean? Stage 1 periodontitis, considered as a borderline between gingivitis and periodontitis, also called mild periodontitis. The severity of this stage associated with the clinical attachment loss in about 1 to 2 mm and radiographic bone loss less than 15% in the coronal third of the affected tooth, while stage 2 represents the moderate periodontitis and the severity of this stage associated with the clinical attachment loss in about 3 to 4 mm and radiographic bone loss more than 15% and less than 1/3 of the coronal third of the affected tooth. Stage 3 of periodontitis associated with the clinical attachment loss more than 5 mm and radiographic bone loss extending to the middle third of the root. Furthermore, tooth loss due to periodontitis at this stage equal or less to 4 teeth affected by periodontitis. And finally, we have advanced stage or stage 4 that we call it a very severe periodontitis. This stage associated with the clinical attachment loss more or equal to 5 mm and radiographic bone loss extending to the apical third of the affected root. Furthermore, tooth loss due to periodontitis equal or more than 5 teeth associated with this stage. In this slide, I want to show you how you can measure the clinical attachment loss, or what is the meaning of a clinical attachment loss. We insert the periodontal probe with a controlled force to the base of the periodontal pocket or gingival sulcus and measure the distance from the base of the pocket to the cemento-enamel junction. This measurement will represent the clinical attachment loss, which is different from the probing pocket depth that we mentioned it previously, since the latter represent the distance from the base of the pocket until the gingival margin. And irrespective of the stage at diagnosis, periodontitis may progress with different rates in individual, which can be estimated by measuring of grading. Grading can be calculated by measuring the bone loss percentage divided by the age of the patient. The 3 grades we have in periodontitis. Grade A periodontitis is assigned if the maximum amount of radiographic bone loss in percentage term is less than the half of the patient ages in year. For example, less than 30% in a 60 years old patient or less than 40% in 80 years old patient. Grade C is assigned if the maximum amount of bone is in percentage term exceed the patient age in year. For example, more than 30% in a 28 years old patient or more than 50% in 49 years old patient. And finally, we have grade B periodontitis in all other situations that not involved in grade A or even in grade C. Finally, this diagram represents a simple explanation about how to estimate the diagnosis of periodontitis, and you should make the diagnosis within 30 seconds after complete examination of your patient. You will start with a radiograph assessment or assessment of clinical attachment loss. First of all, determine the extent of disease if the case is localized or generalized or has a molar incisor pattern. Second, we start to determine the stage of the disease, and of course, you take the worth of your measurement to give the score of the stage. And as we mentioned previously, the stage of disease determined either by amount of radiographic bone loss or estimation of clinical attachment loss. Third, estimate the grade of disease by dividing the percentage of bone loss on a patient age using the worst side. And fourth, determine the stability of disease by measuring the bleeding on propping percentage score. Finally, mention if there is a risk factor associated with the disease progression, such as smoking and diabetes. Thank you for your nice attention.